transition from MDG to SDG, right? So what I see good thing happen during MDG is that we try to provide some kind of measurable and the time-bound objectives, which we did not do before, right? Because translating some of these goals into the targets and making indicator can be quite cumbersome, right? So you will see that in SDG, we have a very elaborate list of goals, targets, and indicator. They are developed at 3 different tiers, right? So MDG at least help us provide measurable and some time-bound objectives, and we learned quite a bit from this. And also, MDG was useful in a way that it promoted the global awareness as a global agenda, and also there is some political accountability for country, that whether they met or don't met, where do they stand, why they didn't meet. So at least they have to answer to something at least. Then also we created a process that we involve international NGOs, involve them into the development process, and also create some public awareness. Then at the end, everything helped to create some kind of pressure for policymakers to act also. So in a way, MDG was quite helpful for us to move to the next level. Now, if you really want to see whether we globally achieved MDG at the country scale, there could be different number, but globally, I'm not going to read each and every line there. You can look at very detailed, but let's say the goal number 1 was eradicating extreme poverty and hunger, right? Now, this poverty rate in developing country was 1990 was 47%, and now that poverty, that extreme poverty rate has been reduced to 14%, right? 14%, and also the global number of the extreme poor reduced from 1.9 billion to 836 million, right? But now you can always question here, what are the indicators, right? You can ask question, okay, what are the indicators for extreme poverty, right? So of course, there the indicator was that $1.25 a day. Of course, I can tell you there are a lot of controversy around that. Some people say that, no, that $1.25 a day is actually not enough. That is that even not enough for subsistence, basic, daily subsistence. And some people argue that, okay, maybe that indicator should have been better. It could have been, at least, $3 or $4. So anyway, at least we put some number, right? $1.25 a day. That was, set as a benchmark. But in any case, the good news is that we could see some progress, and at least we could measure some progress, right? And when these are translated to the developing country, there is some basis for them to work together in partnership, and also there is some basis to provide some kind of support to developing country in order to improve some of these indicators. So in that sense, it was quite achieved. But you can see some of the numbers there. I'm not going to read that number. You can look at later. But in terms of goal number 1, eradicating extreme poverty and hunger, we saw significant improvement. Yeah, of course, you can always question whether the indicator we use $1.25 per day is a right indicator or not. You can always question. And you as an academia always should ask the question, shouldn't take for granted. Now, the second MDG achievements was, achieving universal primary education, right? Now, that universal primary education, this global out of the school children of the primary school age reduced from 100 million to 57 million globally. And also, as you can see here, the primary school net enrollment rate, especially in sub-Saharan Africa, where there's a lot of problem, particularly for health and education, increased from 52% to 80% from 1990 to 2015. Of course, the goal itself was set in 2000, right? So in 2000 to 2015, but there has been there has been improvement. And again, as you see that again here, focus is very much on developing country, poor nation, where this fundamental education, where fundamental healthcare, fundamental things are problem. But we saw some achievements, and sometimes some people argue these are good achievements. Some people argue, oh, these are not enough. So that debate is always bound to happen. But we have seen progress. And a third Millennium Development Goal achievement was in promoting gender equality and empowering the women. Now, how do you measure that, right? How do you measure that? There are at least several indicators has been used. For example, primary school enrollment ratio in South Asia for the male and female children, right? So, for example, it was 74 for the females. Then it was 103. So I don't know what is the basis here. I think it's out of 100 boys. Yes, right. In South Asia, in 1990, there were only 74 girls were enrolled in primary school for every 100 boys, right? For 100 boys, 74. But now that number has actually increased in 2015, and actually 103 girls are enrolled for 100 boys, right? So we have seen improvement. Again, 90% of the countries have more women in the parliament since 1995. So, of course, whether these indicators are correct, whether we need, better indicators, that thing we could discuss. But some of the indicators tracked as a part of this MDG has seen improvements. Now, the goal 4 was reduce child mortality. And as you know that due to awareness of maternal health and also the healthcare facility, child mortality is a big problem, right? Especially in the poor nations and the developing country. Now that has significantly improved in last several decades, but still now that number, really child mortality number was 12.7 million in 1990. So basically, under 5 mortality rate has declined by more than half. So we have made huge achievements there also. So dropping from 90 to 43 deaths per 1,000 live birth between 1990 and 2015. So similarly, the global measles vaccine coverage has increased, which also is important from the child mortality. So definitely we have seen some improvement, but again, you can always question whether that level of improvement is good enough or not, right? Because we can always question that. Now the goal 5th was improving the maternal health. Now maternal health is represented by the global maternal mortality ratio. That means out of the 100,000 death, 100,000 death per 100,000 live birth. That means when 100,000 live births happens, how many death happen? And if you look at data, we have also improved there. It was 380 from 1990 to 2013. So of course, it's a better access of the healthcare facilities, and also the global birth attended by the skilled health professionals. It was hardly 60% in 1990, but it has increased to 70% in 2014. So that number, I'm sure, has increased in recent years. So we have some improvement on maternal health. Now, 6 on combating HIV/AIDS, malaria, and other disease. So again, they have lots of indicators there. Global antiretroviral therapy treatments. How many people had access to that, and also number of the insecticides, treated mosquito nets delivered in sub-Saharan Africa. There are lots of such kind of indicators. But again, I want you to see that again. Please feel that MDGs seems very much tuned to the less developed countries, sub-Saharan Africa, Southern Asia, where all the basic healthcare, education remain problem, right? So, but we see improvement in Goal 6 also. Now, Goal 7 was ensuring environmental sustainability. Now, of course, environmental sustainability is a broad term, and there could be so many things put together. And again, we have seen some improvement there. For example, people's access to the piped drinking water, and also the ozone depleting substance, how much we could tame. So there are several few indicators, but again, as you can see, that this environmental sustainability could be much broader. But again, this was very much tuned to the poor nations, to the developing country, where drinking water is a problem, where so some other kind of problem. Now, last Goal 8 was aiming at developing a global partnership with development, collaboration between the countries, a role of official development assistance, ODA. So the ODA has increased from 81 billion US dollar in 2000 to 135 billion in 2015. Similarly, the other partnership in digitalization, there is 6% in 2000 to 43% in 2015. So anyway, there are several areas were identified where the partnership for development is needed, where the developed country should or need to help developing country very actively. So we have seen some progress, right? So definitely, and the MDGs achievements were given due considerations, and the lessons from MDG to move forward to the next one was useful in the sense that this is more or less first time in that scale, making a goal, try to put some numerical value to it, try to define goal and track over time. So that kind of effort took place in MDG. Then of course the MDG was also tried to be translated at national context. Every country had their MDG goals. They also worked with their tunes, and country try to make their own goals in tune with the global goals, and try to align themselves, and also ask for assistance, ask for support under the Goal 8 for partnership, where developed country could support in those goals, improving some of those sanitation, health, education, primary education, health to the developing countries. So in a way, that was good exercise for us to move forward. There was some discussion I saw there on how nations translated the MDG into their national development agenda. So this has happened, and of course these goals has to be translated in some way with the national goals. Even for the SDG, later on I can share with you, SDG targets they are translating into the national level. So that translation has been done, but we have to look at national context, how much it was successful. Maybe you can do later on. We can see as a part of your assignment or something, we can tune to see how much MDG was successful in your country. We can try to see whether that could be a part of your assignment. So we can discuss that later. Of course, for example, if you go and ask the United Nations and other people who promoted MDG, right, they will say that yes, MDG was very successful, right? So, but many literature also showing that yes, MDG was successful. It did quite nice job, good job, but not so rosy. Picture is not that rosy either. And this is that despite We wanted to eradicate poverty, and healthcare service. Despite that, the poorest and the most vulnerable people are still left behind in this whole process. Gender inequality, which was one of the major aim in the SDG, still persists. We haven't been able to perhaps do at the level, at the speed we needed. And the inequality and inequity was a still problem. The gap between rich and poor, and the gap between urban and rural, and also all these things still persisted, right? So, and the climate change, environmental degradation, in MDG, we try to focus on environmental sustainability, ozone depletion, access to the potable water, something, but still some bigger challenges like climate change, large scale biodiversity problem, deep environmental degradation. We continue to suffer. Rather, we are keep on increasing our emission, right? We are increasing our air pollution. We are increasing our greenhouse gas emission. We really did not do well despite all these goals. And the conflict remain a bigger challenge, and still millions of people still in a poverty, hunger, and still without access to basic service. So we should not. A lot of literature saying that yes, nice MDG achieved something good, but let's not be too happy. World is still difficult place, right? Now, learning from that, then UN Secretary General Ban Ki-moon, in his I think this is from 2012. He said that 2015 is a milestone year. Whatever we did in the MDGs, yes, fine, we did, but not enough. We need much more, overarching framework. And yes, we will do this. MDG, we did it, but we should aim for more universal sort of, one. So that kind of, a call was made. At least there is a recognition that global action is needed, global action works. And we had some experience to do it together as a part of the global action in MDG. So some of those things were taken positively, and that was precursors to the SDG.